Good morning, everyone, and welcome to the New York State Aim for Zeros Symposium put on by the New York State Office of Mental Health Suicide Prevention Center. We're going to just wait a few more minutes to allow people to come into the virtual room here before we hear opening remarks from Commissioner Ann Sullivan. So we'll be starting up in just a few minutes, but thank you again for joining us. And we're just going to give it a few more minutes to allow people to log on.
Good morning. My name is Jenna Heiss. I'm the Director of Implementation in the Suicide Prevention Office Center for New York at the Office of Mental Health, and I am the moderator today. I just wanted to let folks know while we're waiting to get started that I will be moderating the chat today. And so we won't have open questions or formal questions during this opening session, because we're just opening the conference, but I will be in the chat moderating and happy to answer any questions you might have. So please feel free to post any questions that you have for the day or for this particular session into the chat.
Okay, good morning, everyone. And again, a very warm welcome to you for joining us for the Aim for Zero Suicide Symposium. I'm Dr. Jay Carruthers, Director of the OMH Suicide Prevention Center. And we are hosting this symposium. I'd like to introduce, it's my honor to introduce Dr. Ann Sullivan, the commissioner at OMH. Just a little context. So of course, Dr. Sullivan has a lot of impressive bona fides, including she's a clinical professor at Mount Sinai, a fellow of the New York Academy of Medicine, and a member of the American College of Psychiatrists. What really stands out, though, is her lifetime commitment and advocacy for improving systems of care for patients and their families. For many years, I think some of you may know that she was a senior VP in the H&H system with responsibility for Elmhurst and Queens hospital centers. We're very lucky to have had her at the helm over the last 7 years as commissioner of OMH, where she's really skillfully guided the transformation of what's arguably the most complex public mental health system in the nation, really overseeing millions of dollars of reinvestment funds that are designed to really keep people well in the community. Also constantly pushing for increased access to mental health services, whether it be programs for first episode psychosis or the expansion of school-based mental health clinics, or champion the integration of behavioral health and physical health. Dr. Sullivan has really been a force for positive reform of the system. And really, obviously, the last couple of years have been quite extraordinary with historical disruptions to everyday life. COVID's driven increases in clinical depression and anxiety, as well as increased presentations to the emergency room among suicidal children, and really all while laying bare shameful inequities. And what's the saying, never let a good crisis go to waste. I think that's certainly been Commissioner Sullivan's MO over the last 2 years. She's really challenged us to rise to the moment in building a more patient-centered recovery and prevention-oriented system of care. And of course, I'm particularly appreciative that she's been a fierce advocate for advancing suicide prevention across the state, the subject that brings us here today. As we sort of come to the near end of Suicide Prevention Month, September, it's my pleasure to introduce Commissioner Ann Sullivan.
Thank you. Thank you so much, Jay. And it's just a real pleasure to be here this morning to welcome all of you to the Zero Suicide Symposium. And I want to thank Jay and Jenna and his entire team for putting the symposium together, but also for their tireless efforts every day, every year on suicide prevention. I'm just so proud to be involved with the Suicide Prevention Center of New York. And I just can't thank you enough, Jay and your team, for all you've done. We're here today because of your commitment to saving lives, because you are here to follow the zero suicide model, because we know that suicide can be preventable in our healthcare systems. This past year, and it's almost 20 months now, we've all been going through a pandemic that I don't think any of us ever wanted to have to experience. And we also know that the toll is high on New Yorkers. We know that 40%, probably actually higher, of New Yorkers will suffer from serious mental problems because of this pandemic. And that in and of itself is a crisis that we as healthcare providers have to deal with over the next few years, because as we are all also experiencing, this pandemic is very slow to end, and that we're still kind of in the middle of it. So the stress on New Yorkers has been significant. And we also know that last year, and I always like to say the number because every life is so important. In 2020, 44,834 individuals across the US lost their lives by suicide. That's terrible. That's tragic. That's something that we should never, ever have to see. And yet it's part of our society and something we all have to work to prevent. Those lives lost are a ripple effect that affects so many other thousands of individuals in our communities. So thank you for coming here today. Thank you for being a part of a movement that is here to bring that number down as low as we possibly can. The other thing the pandemic has sadly taught us is what Jay mentioned earlier, that our disparities in care are significant and that those disparities in care need to be dealt with. That's going to be a topic throughout this symposium too. How do we deal with it? How do we not have those disparities in care? The one statistic that sticks out in my mind from this pandemic was done by the United Hospital Fund. And they found that in July of 2020, 4,200 youth had lost a parent or a caregiver to COVID. That's incredible. 4,200 families disrupted, and that was in July of 2020. And we know there have been more lives lost since then. We also know that that was twice as often that families of Hispanic or Black families lost their caretakers or their parents. That's unacceptable. So we have to work hard. We have to work hard together on saving lives through suicide prevention. We have to work hard together to reduce and get rid of the disparities in care that we have seen for far too many years throughout our healthcare system. So I can't thank you enough for being here with us today to be part of that movement to save lives. And I really do appreciate your joining us. Thank you for all you've done over the past year and a half. Mental health community has just been, I don't know, outstanding, heroic in the work that we've done to keep our patients healthy, alive, and safe. So thank you. Thank you for bringing hope and recovery to so many New Yorkers. And I know that you're going to have a very good experience during this conference, going to learn a lot and hopefully bring out to the community all the skills that you will learn over the next few days. So thank you so much. And I'll turn it now back to Dr. Carruthers and to get the conference started. Thank you.
Thank you, Dr. Sullivan. We appreciate your time and advocacy. All right. So just a little bit of context for today's for the symposium over the next 3 days. I want to echo the commissioner's sentiments. Thank you for joining us. We are really thrilled with the fantastic set of speakers that we've lined up over the next 3 days. These are really a group of internationally recognized experts in suicide prevention. And we couldn't be more pleased that they're taking the time out to really provide a rich environment to learn and really stimulate, hopefully, all of you going back to your systems of care and working on integrating suicide prevention into healthcare. I mean, that's the essence of the zero suicide model. And just a little context to because you know, you're going to hear among some of the speakers, you're going to hear from former Commissioner Mike Hogan, who this was years ago, used to talk about the zero suicide model being a toddler. I think it's accelerated quite quite rapidly over the last 5 years. And I don't know if we're quite in adolescence yet, but we're certainly beyond toddler stage. We've been doing a lot of work here in New York State to advance and integrate suicide prevention into systems of care, starting with the public mental health system. So, but really some of the original work, there were great contributions by New Yorkers. I'm proud of the fact that we've been able to, of the evolution here in New York. There were New Yorkers that were involved in the beginning of the zero suicide kind of model and development of that model that participated with the Action Alliance. We've continued to try to advance that work here in New York State, primarily through grants. But one of the helpful sort of frameworks that we utilize for that work was developed by our colleague, Dr. Barbara Stanley, and it's called AIM. So AIM for Zero is not really, that isn't something we just cooked up to market this symposium. Really, we've been trying to utilize AIM as a framework for the clinical components of the zero suicide model. So the A stands for assessment, I stands for intervention, and M stands for monitoring. So predominantly in our federal grants, or suicide prevention grants from SAMHSA, we've been attempting, as well as a large NIMH funded grant, we've been trying to utilize that as a helpful sort of roadmap for clinicians. And so that is in part the context for this symposium. You'll hear more about the core components of assessment, intervention, and monitoring. And it really is kind of a synthesis of the national model, the 7 domains of the zero suicide model. Combine that with AIM, and you've got AIM for Zero. And in many ways, that reflects the evolution of the work here in New York State. So let's see here. I think it's important to recognize that and wanted you to understand the context. All right, so I want to again thank people for taking the time out today. And my sincere hope is that people will answer the charge I think one of the refrains in the suicide prevention field is that suicide prevention is everyone's business. It can't be left to the individual sort of heroic efforts of mental health and crisis clinicians. It really has to be a systemic effort, really integrated into the fabric and culture of systems of care. So we hope that you find the content helpful, and that you answer the charge to kind of go back to your system of care and continue to do the work. There's so many ways to engage around this work. It's meaningful work. And most importantly, you're not alone. There are a lot of resources to support you in doing this work as we try to expand beyond mental health systems and get into other settings like emergency rooms and primary care. There's a lot of good work that's been done, and there are resources to help you both here in New York at the OMH Suicide Prevention Center. You'll see presentations will be posted probably the day of here on the Symposium resource webpage. There's a toolkit that's been developed that's really been derived from a lot of the work that we've done from our federal grants, SAMHSA grant, our Zero Suicide grant. New York was really the only state that was selected for the first cohort of that SAMHSA Zero Suicide grant. And we're actually, at the end of this month, we'll be entering our 5th year of that grant. So there's a toolkit on the resource page. The other thing I want to highlight is that we are having a community of practice where we're going to be bringing in subject matter experts, a community of practice for 8 systems of care that apply and are awarded to participate in the community of practice. And we'll be bringing in subject matter experts like some of the ones that you're seeing at the symposium to support those systems of care, doing a 9-month kind of quality collaborative and really around implementation of the Zero Suicide model. So there'll be more information provided on the community of practice throughout the symposium. But essentially, 8 systems of care need to apply. They need to have primary care, emergency room, and behavioral health buy-in, or these are large systems, and it's a prerequisite to have those systems that are willing to participate in the 9-month quality collaborative that's going to be really world-class. So we'll provide more information about that. There's also the SPCNY website. If you just Google it, you can find that easily. And as I said, all the presentations from the subject matter experts for today's conference will be posted probably by the close of business the day of. So I'm going to turn things back over to Jenna Heiss, the Director of Implementation from OMH's Suicide Prevention Center. So Jenna, is there any other sort of housekeeping details or announcements that we want to let the audience know before we officially begin with our keynote speaker, Dr. Ed Coffey, one of the really founding fathers of the Zero Suicide movement? Jenna, you're on mute.
Yeah, hi. As I said, good morning. I'm Jenna Heiss, and work with Dr. Carruthers on the implementation team as the Director of Implementation. And first, again, very excited that you're all here. And thank you to our Commissioner and to our Director, Dr. Carruthers. I have posted some things in the chat. If you're calling in, though, you might not have been able to see them. I do have 2 announcements about speaker changes that I wanted to let you know about. We are saddened that we have lost 2 wonderful speakers, but we are also very excited about the 2 speakers that we were able to get. So I want to let you know one of them will be tomorrow, change, and that is our opening speaker to spotlight, talking about equity and equality and the changes with LGBTQ youth and supporting them with suicide prevention and suicide care. And that is our opening speaker at 8:30 to 8:55 tomorrow morning. And Sam Britton was going to be that speaker. And now we are going to have Keegan Miller, both from the Trevor Project. So we're really looking forward to that. And then on Friday at 10 o'clock, we are not going to have Dr. Barbara Stanley. We are going to have Dr. Richard McKeon from, he's the chief of the suicide prevention branch at the Substance Abuse and Mental Health Service Administration, among many other talents. Again, also being kind of one of these fathers or generators of the zero suicide movement. So we're extremely happy to welcome Keegan and Richard to the event. So I did want to let you know that. The other two, the other announcements, as I said, I put into the chat over here, they're kind of housekeeping announcements, but a lot of people are wondering about being able to access the recordings. So every session is recorded, even this one, and all openings and closings, and then each of our events. And this platform, this entire platform with the auditorium and the exhibits and the lounge will be open for 30 days after today. And you'll be able to come in and access all of these things. You'll be able to look at all the resources that are available, and you'll be able to look at all of these different presentations again for up to 30 days, and you can download them. And you should be able to see features for each one of these if there are handouts. Of course, there's not a handout for this opening right now, but there'll be handouts and all the PowerPoints, and you will be able to actually download those for free if you have enough storage in your own web space. If not, if you can find that on the cloud or however you do that kind of thing with Vimeo or whatever. And then, excuse me, any technical issues that you have, there is a chat feature on the side that comes out in a little kind of pop up over here on the main screen in the auditorium. And then you can also go to the information desk if you're having any kind of questions or issues, but I've also posted in the chat right here actual web, I think it's an email. Yeah, it's an email that you can go to, which is aim for zero suicides at getvfairs.com or no, .io. And then the last one is just, I'm going to let you know that some of our times have shifted 5 minutes. If you had logged on before today, when you did your registration to look at the times of the presenters. And so very excited to be able to offer CEs, continuing education credits and units for our longer sessions that are 50 minutes or longer. And then for our CMEs, we are also able to offer those. And so we're very, very excited. So take a moment if you are interested or you need those credits or you want those, to look at the agenda on the main page and scroll through that and see it will be listed next to the name of the presenter who is going to be able to offer those, not who, what presentations. And excuse me, it just has to do with the length, not the quality or anything of the presenter or the presentation. And the other announcement is that, so for today, there will be CEUs and CMEs for the next 3 presentations, plus there will be CMEs, a half credit for the panel at the end of today. So those all start on the hour, and they will go from, the next one will go from 9 to 9:55 with Dr. Edward Coffey. And then Dr. Ed Bordeaux will start from 10 to 10:55. And then Dr. Hogan will start from 11 to 11:55. And then we'll have our panel discussion, which is just a closed structured question and answer session where I interview Dr. Coffey and Dr. Hogan for 30 minutes. And that will go from 12 to 12:35. And then our day will close. And so we're very excited, really look forward to the day today. And we are closing out now because it is time. I hope to see you.
Jenna,
Yeah.
we got a question. Is there C for psychologists as well? Do you know? I don't know the answer to that. I know there was a lot, but are psychologists covered?
It depends on if you can get credits through. I would just turn this all into to that, excuse me, accrediting association and see how that goes. It's my best answer, but also just send that question through to our general email at the very bottom of the opening page. I do want to close this session in response to time.
Yep.
And please send that question to our main email.
We
Thanks,
hope you
everyone.
all join us in the next room with Dr. Ed Coffey and for the keynote address.
Yes.
Thanks again, everyone, and have a great day.